Welcome back, everyone. And in this special, we will be looking at healthcare both in America and Thailand. But first, let's go for a drive.
Would you take me out to Johnson sometime, Pa?
Sure. Mr. Johnson might even let you milk a cow.
Looks like to me you got too much grease in the steering column.
Now, you may be wondering what Barney's old car and hospitals have in common. Have you ever had a car that required some work? Maybe it was just a tune-up, or perhaps the engine needed an overhaul. But something had to be done to get the car running smoothly again. And usually, a mechanic is needed. A mechanic works on the same principle that many hospitals do. For example, both will do small jobs like changing oil or suturing up a dog bite without even asking if you can pay. But if the engine needs to be overhauled or surgery is required, then both businesses generally ask if you have money to pay for materials and labor. The word hospital comes from the Latin noun, which more or less means the relationship between a guest and a provider of lodging. And throughout centuries, and even in today's world, that relationship is not always smooth. Both Thailand and America have two basic types of hospitals: government or private. The hospitals run by Uncle Somchai are plain and simple, much like the ones operated by Uncle Sam. They are not perfect, but most workers try their best. One of the big differences between the two countries is the private hospitals here. Many of them are like fancy hotels, and one would expect that they would be expensive. Thank you. However, medical care in Thailand is significantly cheaper than in the United States, often costing 50% to 75% less. To try and find out why, we need to head back to high school. Football can be a rough sport, especially if you're not very good. Then I was an earth dart in the Army. This is also hard on the knees. Eventually, Father Time said that a knee replacement was needed, and the orthopedic surgeon in Bangkok had been trained at Mayo Clinic and installed a titanium knee. The total cost was around $12,000. Now, if this surgery had been done in the States, the bill starts at $40,000. Big difference. Here's another example. Many years ago, I was sitting outside our Bangkok home with the front gate open, watching our dog Pepsi as she walked and sniffed the quiet street. Then suddenly, a large stray dog appeared and the fight began. I ended up having a few stitches and a rabies vaccine treatment. The total cost was $200. In America, that same treatment would have easily cost $1,000. Medical care in Thailand is less expensive than America for several reasons. The wages and salaries for medical staff, including nurses, technicians, highly trained doctors, and the whole bit are substantially lower than in the U.S. And let's take a look. Let's begin with the backbone of the medical profession in both countries, which are the nurses. A licensed practical nurse in Thailand makes about $3 an hour. Try hiring an LPN in America on that wage. Here are some of the family docs from the local government hospital. And just like in America, they work the most and get paid the least. These Thai docs might make $30,000 a year, maybe. And I'm thinking that in the States, they make a tad more. Recently, a visit to a plastic surgeon at a private hospital was in the spotlight. Smart dude with a great sense of humor. I didn't ask, but let's assume that he makes about $100,000 a year. Let's also assume that the salary of plastic surgeons in California are cut above that. This guy who stopped by happens to have one of the highest paying medical professions in Thailand, which is a neurosurgeon. But I will guarantee you that these docs don't even come anywhere close to the $1 million nerve like their counterparts in the States. Now let's talk drugs. This is the old drugstore in my hometown. A customer can get about any over-the-counter drugs like aspirin or Tylenol, but for most drugs, a prescription from a doctor is needed. Thailand operates a little differently. This young woman wearing shorts is a pharmacy student who stopped by with her family for pizza. The government is paying for her education, and in turn, she will pay back the loan by working in a clinic or local hospital for a few years. The Thai government produces many pharmaceutical drugs, making medication much cheaper compared to the U.S., where drug costs are a major cost of medical bills. This is a prescription for 12 antibiotic capsules that cost me $9. In the States, this price is easily doubled. Now here's the good and bad about this. Good, because the drug is cheaper, and bad because Thailand hands out antibiotics like candy. No need to see a doctor. Just go to any drugstore and they'll give you something. As you can tell, I still have all 12. Moving on, unlike the U.S. system, many hospitals in Thailand offer clear upfront pricing and treatment packages, allowing patients to know the full cost before a procedure. I learned a new term a few years back, and that is medical tourism. The truth is, back then, I did not know such a concept even existed. And as it turns out, it is big business. Thailand's success as a medical tourism hub means that these private hospitals must keep prices competitive to attract international patients. This drives down prices while maintaining high standards of care. When I need a tune-up, I simply sign my name and pay cash. Not nearly as expensive as a hospital bill from the States. But regardless how much cheaper it is, everyone pays at a private hospital. Now let's look at medical insurance, and I will use Blue Cross and Blue Shield installing our new gutters as an example. Basically, medical insurance is supposed to prevent the drainage of your life savings when your body springs a leak. House guttering handles the drainage of rainwater when your roof springs a leak. And with both examples, you don't know the truth about their services until it starts to rain. We will start with Thailand's insurance system. Just like in America, many docs operate an evening clinic to help out folks that have to work during the day. However, a big difference is what most Thais pay for doctor visits that are in the system. Thailand has a near universal healthcare system for their citizens. It was launched in 2002 and provides health care coverage for over 47 million Thai citizens, which is about 74% of the nation's population. It's called the Gold Card or 30 baht scheme, and how much is 30 baht? Less than $1. This is what folks pay every time they see a doc. This also includes being in the hospital. Yes, there are some hiccups in the system, but it is a good start. The U.S. health insurance system is confusing and seems to boil down to every man for himself. To start with, there are complex billing practices where hospitals negotiate and charge significantly inflated prices to insurance companies. Neither organization really cares, as it is the patient footing the bill. I think the legal term is being in cahoots with each other. Think of it like this. You are at a weekend healthcare flea market looking for the best and most affordable way to get medical coverage for your family. All you see is a confusing collection of independent vendors. There are hospitals, specialists, primary care doctors, labs, pharmacies, and dozens of insurance companies, all with their own rules and prices. This lack of coordination is inefficient and costly. In America, it's common to see an ad like this on TV or billboards, and this is another big reason why medical care is so expensive. It's easy to blame the lawyers, but keep in mind that they need clients. Many Americans like to sue anyone for anything, and this behavior has resulted in extremely high cost liability insurance for doctors and hospitals. It's not coming out of their pocket. It comes from the patients. Thai courts tend to limit damages and malpractice claims primary to actual losses like medical expenses and no paycheck coming in. Awards for pain and suffering are unusual or minimal compared to the multi-million-dollar jury awards seen in the U.S. Plus, the Supreme Court in Thailand views the concept of where the lawyer takes a percentage of the final award as being against public policy and good morals. Then there is the practice of defensive medicine, where doctors order extra tests or procedures primarily to avoid the risk of a lawsuit, which significantly drives up healthcare costs. What is the solution to affordable healthcare? There is no simple answer, but I believe that the first responsibility of any country is to protect their citizens, and this includes helping them when they get sick or injured. A broken leg shouldn't bankrupt a person. Are you listening, America?
Doctor, my eyes, tell me what is wrong. Was I unwise to leave them open for so long? 'Cause I have wandered through this world, and as each moment has unfurled, I've been waiting to awaken from these dreams. People go just where they will. I never noticed them until I got this feeling that it's later than it seems. Doctor, my eyes.
Thanks for watching, and I'll see you later.